Pre-genetic testing of aneuploidy, or PGT-A, is a technique that we can offer for testing an embryo for genetic normality. It's an important option for people, particularly if you've had failed cycles, if you're a little bit older, if you've had miscarriages, or if you're considering something like surrogacy, because it gives us more assurance that the embryo we're selecting to be transferred back into the uterus is genetically normal, or euploid as we call it. The reason so many IVF cycles fail, particularly in older women, is because the embryo is not genetically healthy. And unfortunately, we can't simply test an embryo by looking at it under the microscope. We can't tell if that's genetically normal just by its appearance. We actually have to take a small biopsy of cells and measure the genetics of the embryo. And that's the principle behind PGT-A. So a lot of people now are electing to have PGT-A because they have decided, after having perhaps had a failed cycle or talking to other people that have had failed cycles, that they want to have more assurance that the cycle will lead to a healthy outcome. During the process of PGT-A, we will prepare the embryos in exactly the same way as if we were going to transfer an embryo into the uterus. But prior to that time, we will take a biopsy of 3 to 5 cells and then freeze the embryo, because we want to wait for the result of the genetic test, which can take up to 2 weeks. So PGT-A is not a good idea if you want to have a fresh transfer in the cycle of treatment. It's not necessary if it's your first cycle of IVF and you've never tested, your fertility with IVF, but it may be a very sensible option if you have had several failed cycles. And certainly for people who are considering using a surrogate, it's very reassuring to know that the chances of pregnancy are going to be higher because you are reassured there's no genetic abnormality, and for your surrogate to know that the embryo that's being selected for transfer has been tested.